The two most common questions that I get about recovery from a facelift is how much pain will I be in and when will I be able to get back to my normal activities. Pain is very unique to each patient, and so it's hard to 100% predict how somebody's going to perceive pain. However, I can tell you that the majority of our patients within 24 to 48 hours are already reducing their pain medication. We do use narcotic medication. I do expect that our patients are all going to need that the night of surgery after the numbing wears off. But it really varies quite a bit in terms of how people feel the next day. And usually within 24 to 48 hours, patients are already starting to either miss doses of their medication or starting to switch to Tylenol or extra strength Tylenol. And that's good actually, because the longer they're on the pain medication, the more you start having other side effects such as constipation and things like that. Some patients get nauseated with the pain medication and they want to switch over as soon as they can. The second question is how quickly can they get back to their normal routine? There are restrictions during the first 3 weeks of surgery in terms of being too active too soon. We don't want them lifting more than the equivalent of 10 or 15 pounds. Don't want them going to the gym or swinging a golf club or things like that. I don't want them doing activities that have unpredictable potential consequences, like riding a horse or something where they don't have total control over what's happening to them. Going out in the ocean, for example, things like that, not a good idea. However, if they feel like they look presentable, there's nothing that keeps them from getting out in public with makeup, for example, or wearing their hair forward. Some patients have had social encounters with other people, even during their first week. So I leave that up to them in terms of what they're comfortable with. It's just I don't want them to do things that get their heart rate or blood pressure up or be too active where they're lifting or straining. So we do put restrictions on that. Once those restrictions are lifted, people can pretty much go back to the normal activities. However, we do tell them that they need to be careful to not expose any residual bruising or discoloration to the sunlight. Same with the incisions. The scars are very fresh at that point and they're very sensitive to the sun, to burning and so forth. So, we would advise people to wear sunscreen. We usually have them start scar therapy at approximately 3 weeks using liquid silicone type products over the scars to help soften them and help to flatten them down sooner. In rare cases, sometimes we have to help scars along with some injections of Kenalog or 5-FU, which is a medication that helps to shut down the inflammatory response that causes scars to continue to grow. So these are all things that are part of the routine of recovering from surgery and getting back to normal activities. I hope you've enjoyed this video. If you have any more questions or you want to make an appointment for a consultation, please feel free to contact us at newportfaces.com. Call us or text us at 949-566-1032.